Is genetic counseling covered by insurance for my family? Imagine taking a step toward understanding your family's health story and wondering if your insurance will help cover the costs. That's a common question for many families considering genetic counseling. Let's explore what you need to know. Genetic counseling is a service where trained professionals help you understand how inherited conditions might impact your health. They also interpret genetic test results and guide you through medical decisions. When it comes to insurance, coverage depends on several factors. Your specific insurance plan, the reason for counseling, and your family's medical history all play a role. Most private health insurance plans do cover genetic counseling, especially if a doctor recommends it. For example, if you have a family history of certain cancers like breast or ovarian cancer, your insurance is more likely to pay for counseling. Under the Affordable Care Act, genetic counseling for women at higher risk of breast cancer is usually covered. Many plans also cover genetic testing if it's medically necessary. However, coverage isn't the same everywhere. Some insurance plans might need pre-authorization before covering counseling or testing. They might also have restrictions based on your health history. It's important to check with your insurance provider before your appointment. Confirm what services are covered and what costs you might have to pay. Medicare, which covers health care for people over 65 or with certain disabilities, does cover genetic counseling and testing. For example, if you have a personal or family history of cancer that meets their criteria, Medicare may pay for BRCA gene testing. Medicaid and other public programs may also cover genetic counseling, but policies vary from state to state. It's good to remember that genetic counseling and genetic testing are often billed separately. Just because your counselor is covered doesn't mean the test will be. Insurance companies may require proof of family history or other documentation before they approve coverage. If your insurance doesn't cover the services, you might need to pay out of pocket. Some labs offer financial assistance programs for those with limited coverage or no insurance. Costs to you can include deductibles, co-payments, or co-insurance. Always call your insurance company ahead of your appointment to clarify what's covered and what you'll owe. Your genetic counselor can also help you understand your benefits and discuss potential costs during your session. Privacy is an important concern too. Laws like the Genetic Information Non-Discrimination Act protect you from discrimination based on genetic information in employment and health insurance. But these protections don't extend to life, disability, or long-term care insurance, and there are some exceptions. When preparing for your family genetic planning and counseling, gather detailed health information from your relatives. This helps your counselor assess your risk and determine if testing is needed. During your appointment, ask about insurance coverage, costs, and privacy protections. Your counselor can guide you through the process and connect you with resources if you face financial barriers. In summary, most insurance plans do cover genetic counseling when there's a medical reason. But coverage varies, so it's best to check with your insurer beforehand. Working with your genetic counselor can help you understand your options and make the best choices for your family's health.